Hello, my name is Dr. Lucia Cagnes, board certified OBGYN, streaming from beautiful Cape Cod in Massachusetts. Welcome to my YouTube channel about HPV infection. In this video today, we're going to talk about how dietary nutrients may defend against HPV. A longitudinal study across 4 different clinics presented by Dr. Goodman at the 22nd International Papillomavirus Conference introduced a very important concept on how patients who are deficient in some nutrients in their system might actually be affected in the worst way by HPV infection. In the study, there was a sample of 42 patients divided into groups depending on the serum level of 2 important nutrients, vitamin E and vitamin A with carotenoids. The study revealed that patients who had low serum level of vitamin A and vitamin E, that means these patients were deficient in these important nutrients in their system, had 70% increased risk of persistence of the virus in their body, where women or patients who had normal level of these 2 nutrients were able not only to protect themselves easier against infection, but also promote clearing of the virus from their body. Dietary nutrients are extremely important for optimizing our health and protect our immune system. A well-balanced diet that is rich in phytonutrients, green vegetables, lean meat, and fruit provide important nutrients to keep our body healthy. Some of these nutrients have a function of antioxidant, meaning they reduce the radical damage in our body that can compromise the functionality of the immune system and promote inflammation. We know the immune system is the first line of defense against HPV. There are no medications available to fight the infection with HPV. Therefore, it is extremely important to keep our immune system healthy. Vitamin A is a leading anti-cancer vitamin and is specific for cervical health. It does promote a faster turnover of the cells at the level of the cervix that can assist in shedding the virus faster from the body. Vitamin A is present in a lot of different food sources such as fatty fish, sweet potatoes, fruit and vegetables, and is very important also for our high health, optimize our sight. Vitamin E is the leading antioxidant vitamin. In fact, it does have an effect on immunoregulation, meaning that stimulate the immune system to work in a very balanced way, and helps to suppress the level of inflammation from our body, which can be a leading cause of many diseases. Vitamin E is contained into olive oil, for instance, and nuts. Of course, is available also under the form of supplements. Recommended doses for vitamin A is 5,000 international units daily, and for vitamin E, 800 international units. patient must be very careful when taking these vitamins because they might interact with other medications that patient may be taking for other health condition. Another extremely important nutrient, the vitamin, is the vitamin D. Also has a function of regulate our immune system and preserves our bone mass, regulating the calcium metabolism in the body, mainly the absorption of calcium from the gut. We only manufacture vitamin D when we get exposed to sunlight, but we can also get vitamin D from our diet. In fact, vitamin D is present in fatty fish also, and fortified dairy products. Reducing the level of stress is extremely helpful also in preserving the function of our immune system. We all live under a lot of stress these days, and we need to find the ways to minimize the damage the stress can cause in our body, and especially in the direction of immune system. Getting enough sleep, 7 to 9 hours of restorative sleep, is extremely important in fighting a stress response. Also, practice of relaxation, meditation, yoga, and exercising daily might help us to fight the negative effect of stress, helping our immune system work more effectively. A second line of prevention against HPV is also represented by the HPV vaccine. Can be primary prevention, but also secondary prevention. Primary prevention meaning that people who never were in contact with HPV, by getting the vaccine, might prevent the infection with HPV. Of course, the vaccine is only good for 9 different strains of high-risk HPV, so it doesn't cover for the 220 different high-risk HPV that are present in our environment. But those 9 different strains of HPV that are represented in the vaccine are basically the most dangerous viruses that have been more commonly associated to formation of cancer in our body. The vaccine might also offer a secondary prevention for those patients who already have been in contact with HPV. Some studies, in fact, indicate that getting a HPV vaccine for these patients who already have HPV in their system might assist the immune system in clearing the infection from the body faster. We have to be aware the FDA approved the vaccine for individuals up to 45 years of age. So older patients basically don't have access to the vaccine because the vaccine is not covered by insurance. Please let me know if you have any question about this important topic. You can find me on my website www.yourhpvmdcoach.com. Thank you for listening, and I will talk to you soon.